Hey everybody, Dr. Barron here with virtualheadacheспecialist.com. I want to talk about occipital neuralgia today. So the occipital nerves are these little nerves that come out of the base of the skull. They come out from the upper cervical spine, C2-3 levels. They come up, they pierce through the muscle below the skull base, and then they wrap over the edge of the bone in the back of the head. So if you feel the back of your head, right in the middle, and you go about 1/3 of the way over, that's kind of, there's a little groove there, and that's where the main branch of that nerve travels. There's another branch that goes behind the ear called the lesser occipital nerve. But basically these nerves innervate about like that. And if they're irritated, they can cause a lot of pain. The pain can be sharp, shooting, stabbing, zapping, electrical, burning. It can be throbbing, pounding, just a pressure. It could just be a dull ache. So it's pretty variable in how it feels, but it can be really miserable. And so the cause of this occipital neuralgia is often really not of a clear reason. It is related to if the muscles are tight, those muscles below the skull base, that nerve pierces right through that muscle. So if you can imagine them piercing through this muscle, if that muscle is tight, it's going to squeeze on the nerve and keep them irritated. If there's a lot of arthritis in the neck, if there's neck injuries, neck surgeries, these things can predispose to it as well. But it can often just happen. Sometimes you see this after a viral syndrome where the nerves get irritated from a virus. So there's a lot of reasons for it. But think of occipital neuralgia like a sciatica of the head. That's really a good way to think about it. And so it's this pain that kind of goes up into the back of the head from the base of the skull. Treatments for this, the first treatment I like to suggest is usually neck physical therapy. If you can loosen out the tissues and the muscles below the skull base there, upper neck, the more loose those muscles and tissues are, the less they're going to irritate that nerve as it pierces through there. So that can be very effective. That's always an easy conservative thing that really everyone should have. Medications, there's a lot of medicines we might use for this, and we go after medicines that are good for nerve pain. So these are things like gabapentin, amitriptyline, Cymbalta, and assuming the right doses. A lot of people start these medicines too low. They don't go to the right dose, and they don't take it the right duration of at least 3 months. So you're not going to get a good effect if you don't do the right trial of these medicines. And there's certainly others as well. You can talk to your doctor about other options. We will sometimes do occipital nerve blocks. This can be a quick fix that can give some pretty significant relief. Unfortunately, it's usually more temporary relief, days, weeks. I do have patients that can go 3 months with it, but I think that's less common generally. In my blog, there is a couple blogs I have on occipital neuralgia with more details about these treatments. If you look at the image right here, this is from one of my blogs where I like to do occipital nerve blocks. So this is the pattern I like to do. I like to hit that nerve in 3 distinct spots as it travels through the back of the skull there. Extreme cases where patients are just not responding to medicines, are refractory, they're not tolerating medicines, they're miserable. There's definitely those patients out there. We do something sometimes called occipital nerve decompression, where they make a little incision over that nerve and they release it from the tissue. That nerve travels through the scalp. It's a very fibrous tissue, and as it travels, it can get tangled and twisted over time, and that can pull the nerve and irritate it. And so the occipital nerve decompression, they make an incision, they release the nerve from that tangled tissue, and that can often take away that irritation. So that's something that is always on the table if we're not making progress or patients are just miserable. So occipital neuralgia can also trigger migraine. It can be a source of migraine. Most patients we see with chronic migraine have some degree of occipital neuralgia, and if you feel along the base of the skull there, that's right where you may feel some tenderness back there. Sometimes it may wake you up at night. If you lay on it, it's going to irritate that nerve. So those are some highlights. You can read more details about occipital neuralgia and various treatments and information about it in my blogs. I'll link to those in the comments below. All right, you guys have a good rest of the day. Take care. Bye.